I've held so many parents' hands and sat with them 2, 3 in the morning with them in tears, like, what could I have done different? Why are we here in the ICU? Um, why is my kid on a ventilator? Is this life support? Are they going to make it? Do I need to start planning a funeral? Very heavy conversations at the middle of the night, right? And, you're not talking about a parent, you're talking about, a 3-year-old, you're talking about a 6-year-old. Um, these things that nobody plans for, you know what I mean? And I, I realized that parents either don't know when is something an emergency, um, or you have parents that are coming to emergency rooms that their kid isn't that sick, and then they're frustrated with medical care that they're there for 2, 3 days, or they're stuck in an ER, they're transferred to another ER, and they never get admitted. It's like, well, then I just wasted all this time. My kid's in the hospital. They could have contracted something else while they're here. Frustration on both sides. Um, and if I can provide any type of support for these parents on either what to do quickly or when to recognize that something is beyond capable to take care of themselves, then I'm going to do that, and I'm going to talk about it, and I'm going to be annoying about it because I had one parent joke with me saying, well, I hope my kid has an emergency so I can use your information. And it's like, that's like, I'm glad you're supportive. um, but if I can repeat it, so many times, like, as something as basic as CPR on, how to check pulse, or when to recognize respiratory distress, because if you can recognize it, several days before, because kids can compensate for a long time, you can recognize something several days before, we can get them treatment in a pediatric office way before they're needing to be intubated on a ventilator in the ICU. Sometimes it happens, and that's where people end up, and that's where kids end up. But there's a lot of things you can do before you get to an ICU.